Hello, my name is Colby Gunter, and today I will be discussing what is hemophilia, how do we treat it, what is the current cure, what are some future ideas for this cure, and why that cure when treatment is so important. So what is hemophilia? Well, it's pretty simple. It is actually just a mutation within the genes of the chromosome, and specifically males. And so what this does is it does not allow essentially men to have a clotting factor. And so moderate to light bleeding can actually be a whole lot more harmful and a whole lot more dangerous for these individuals. And as you'll see later, the lifespan was actually often extremely minimal and compared to a healthy human being. So yes, we will be discussing hemophilia. And so currently in the United States, as it stands, 30,000 to 33,000 men are diagnosed and to have found to have hemophilia. And this number is actually quite relatively small, obviously, to the American population. So how is hemophilia diagnosed? So currently, as it stands, hemophilia is diagnosed by blood tests that assess clotting time and factor levels. And so these two different things, the clotting time is that after someone starts bleeding, how long would it take a normal male at that age and that size to clot up and stop bleeding versus one who is believed to have hemophilia? And then the factor levels is a blood test, essentially looking for these factors, or which are simply hormones that are made from cells. And if the cells are making less, then it's likely that they have hemophilia. And if the cells are making them at normal levels, obviously, this is something not necessarily something to worry about. It can also be diagnosed by genetic testing, and this is essentially taking genetic test of your father and your mother and kind of determining if you're more likely based on their genetics and their chromosomes, and if your father is potentially has something that could warrant you having it as well. Taking family history, this is relatively the same thing, but if your father does have hemophilia, then obviously that does play a factor. That's something that's already known versus genetic testing. The father might not know that he has an allele that is not dominant. Physical exams is essentially what we talked about in the last earlier, which is clotting time and factor levels. So physical exams are after causing a bleed, how long would this normally take to clot versus someone with hemophilia, how long does it take them to clot? And that will determine the severity of the hemophilia. And prenatal testing is essentially the same thing. This just happens after someone is found to be pregnant, and the parents kind of want to know, okay, what can we expect from this baby after they're born? The current treatment for hemophilia is actually relatively or extremely better than the past. And so the primary treatment for hemophilia involves replacing the missing clotting factors with concentrated factor 8 and factor 9. And so what this means is that essentially you're doing an intravenous injection. And so instead of, as we'll see later, stimulating cells to produce this factor, the cells cannot make this factor, this hormone. And so what you're going to do is you're just going to inject it to the patient themselves. So for hemophilia type A, you're going to be injecting factor 8, and hemophilia type B, you're going to be injecting factor 9. And so they will just be taking these injections over a course, probably once to twice a week, maybe less. And in often serious cases, prophylaxis is used very often, roughly 2 to 3 times a week. And this is for serious cases. This is for patients who very rarely or probably make hardly any factor clotting or clotting factors at all. Other medications for mild cases include desmopressin, which can stimulate cells to release more factor 8. So the cells do not necessarily lack the ability to produce the factor, but they produce little to the point to where it's necessary to have medication to get involved. And so the importance behind the treatment is relatively simple: to prevent or reduce bleeding episodes and to minimize the long-term complications of joint damage and other health issues. The quality of life for individuals with hemophilia has increased rapidly over the years, and that is the important thing that we talk about when we talk about hemophilia. People who have to stray away from certain exercises or activities as kids, like dirt biking or skiing, in fear that maybe a compound fracture could seriously put them in the hospital, having that clotting factor definitely helps, and it produces a better quality of life. Before 1968, the average lifespan was 11 years for people with hemophilia, whereas the lifespan now is roughly 68 years. So a dramatic, like I said earlier, improvement. By using treatment, patients can enjoy life and not prevent themselves from slightly active activities and worry of bleeding. And so, final thoughts: hemophilia is extremely important to treat. And with more research, hemophilia can obviously, as we've seen since 1968, rapidly improve the quality of life for individuals with it. And at the end of the day, they can function just like